Welcome to the Maryland Healthcare Commission's Health-care-AI Symposium. This presentation is part of a virtual symposium on the equitable, ethical, and responsible use of artificial intelligence in healthcare. The symposium features a range of presentations on AI risk management, from cybersecurity to AI-specific issues, including algorithmic bias, data integrity, and transparency. Visit the Maryland Healthcare Commission's website for more information. You can find a link to the Healthcare AI Symposium's webpage featuring all of the presentations in the description box below this video.
Hi and welcome. I'm Mac Benro. Thank you for exploring the Maryland Healthcare Commission's Healthcare AI Symposium series. This next discussion explores the intersection of consumer health data and AI. Our guest speaker will highlight the importance of ensuring privacy, transparency, and responsible use of consumer health data, which may not always have the same protections covered under HIPAA, depending on where and how the data is generated. Sarah Gagan is Senior Counsel at the Electronic Privacy Information Center, where she focuses on commercial surveillance, consumer privacy, and health and reproductive privacy. Sarah is a member of the District of Columbia Bar and the Illinois Bar and brings a depth of experience in consumer privacy and advocacy. Sarah, thanks for being part of MHCC's Healthcare AI Symposium. I'll now hand it over to you.
Thank you for having me. I'm excited to be here to talk today about data privacy protections for health-related information. Today we'll be speaking about AI and health privacy. As Mac mentioned, a lot of information is not protected in ways that we would think, so we'll talk about this today. AI feels like it's everywhere, with things like ChatGPT being deployed to consumers so readily. It seems like every conversation I have is about AI. And while it has a lot of promise and innovation, it also is not a neutral technology, and it can create and exacerbate harms. Some of the risks of unprotected or use of AI without safeguards are things like discrimination, if data sets reproduce certain biases. There are privacy harms for things like information that is fed into a large language model, and the results can sometimes use that information in its outputs in a way that can be revealing of information about the prompt. There are serious concerns about, excuse me, about the environmental impacts of AI. Things like excessive energy and water usage go to power data centers that are used in the process, and even in every time a large language model is used. So, as I mentioned earlier, so much of this information is generated constantly about us. Our devices, our computers, our phones, our smartwatches are constantly collecting, generating information about us. And that information is paired with other information that exists, oftentimes by data brokers, to be very revealing about us. Websites use things like pixel technologies or other tracking technologies like third-party cookies to collect information about users and share that in ways that we don't expect. And this can be highly revealing of things like health characteristics, because our searches and our location information, as well as our actual devices themselves, can generate health-related information that is not protected by HIPAA, which people often think it is. We'll have an example of this later, but when things like AI chatbots are used and people are asking it for health advice, that information then goes on to train more large language models. So people's health information that they're giving to a bot or to AI can be used to train, and there are very few safeguards for what kind of data goes into those training those systems for things like bias or accuracy. The data ecosystem is massive, and each day massive amounts of data is generated about us to link and profile us. People think that HIPAA, which is the Health Insurance Portability and Accountability Act, covers health-related information. But while HIPAA is a very strong law, it has a narrow scope, and HIPAA only applies in the traditional patient-provider context. Um, so things like apps, even the apps that you might use for tracking health, like a menstrual tracking app or a nutrition app or a app that is connected to a blood pressure cuff or monitor if you have one at home, are not covered by HIPAA, so they don't have those privacy protections. And as a result, most of the information generated about us that is more consumer health information is largely unregulated at all.
Sir, before you go on, could you talk a little bit more and maybe provide some examples of what this consumer-generated health data is?
Yes, so this is there's two pieces. There's the direct information that is collected, and then there's inferences. So at first, the direct information that is collected can be anything like being at a website um, for a doctor's office and going to make an appointment and entering all of your information, the reason for your visit, when you want to come, sometimes your symptoms, your height and weight, your previous existed medical conditions, etc. And tracking technologies can be embedded in those websites and collect that type of information. Things like your Fitbit or smartwatch might collect biometric information, your heart rate, your pulse, your oxygen levels. Um, Also things like your browsing history, if you're searching for, your symptoms, if your location information, if you use Google Maps, for example, it might show if you're at a dialysis center, that might show you have a kidney problem, or if you're at a weight loss clinic. So information that isn't just directly in your chart at a hospital or with a doctor can still be very revealing of your health status or your health characteristics.
Thank you.
And yeah. Um, and because the United States does not have a general comprehensive privacy law at the federal level, this information is largely unprotected because it falls outside of the scope of HIPAA, because it falls outside of the traditional physician-patient relationship. You don't have patient confidentiality with your Google search, for example, even though your Google searches can be quite intimate and reveal a lot about a person. Um, in the absence of a general comprehensive federal privacy law at the national level, many states have passed comprehensive privacy laws, Maryland being one of them. Maryland has a very protective, pretty strong law that just was passed. Some states have weaker privacy laws, but because each state has slightly different general comprehensive privacy laws, this leaves a kind of a patchwork where it can be very confusing for companies, for providers, for patients, what the standards are for collection and processing of personal information. And this can be actually quite harmful when we're talking about things like reproductive privacy, where we have states with competing and contradicting laws, where maybe one state is actually protecting abortion-related healthcare and one state is criminalizing it. It's a very confusing landscape to have different conflicting laws. And those are general comprehensive privacy laws. Like I said, Maryland has one just recently. There also are sectoral specific privacy laws. Colorado has an AI Act, it's AI focused, and Washington State has a law called My Health, My Data Act, which is specifically about today's topic, consumer health information. And it does regulate the collection and processing of consumer health information. And it's a very strong law because it includes inferences. So not just the information that is collected if it's revealing your location information at a health facility, but also if all of your data sets, all of your data points combine could lead to someone to infer a health characteristic about you, then that information is protected under that law. This is about Maryland's very exciting Data Privacy Act, MODPA, the Maryland Online Data Privacy Act. And this is just an example of the sometimes confusion of the patchwork, where it can be very tricky to try to keep up with all of these different laws and comply with them. And this was last updated at the beginning of July, but these things can change very quickly. State legislators can move bills quickly or not, but it's a confusing and chaotic legal landscape. If anyone is interested in learning more about the state of state privacy laws, my work has put together this rubric about AI specific bills as they move through the states, because some are more protective for consumers than others. I'll talk next about location data, because location information can be perhaps the most revealing of our health characteristics. If your location information, which is generated almost all the time in real time by our phones, our computers, our cars, and our watches and devices, it can reveal if you're at a health facility. So if I attend an addiction treatment center, my location information, even stored in my map application, shows what I was being, a health characteristic that I was, or healthcare I was obtaining. It can show if I was at a hospital, an abortion clinic, a cosmetic facility, and this can be revealing of a very specific health status. This is often used to feed targeted advertisements to us in real time. There's a practice called real-time bidding, which uses AI or algorithms to deliver us targeted ads based on our entire data profile. So when my device loads a web page, in a few milliseconds, an algorithmic bidding takes place to determine what ads I will see on the page. And this uses large language models and AI, and often very sensitive health information to deliver ads. And I have a picture in just a few slides of some of the information that can be broadcast to third parties and to advertisers during that practice. Data brokers are corporate entities that trade in our personal information. So they collect information from all of the different devices and sources that I had just mentioned, and they pair this information to profile us. And they will have categories of things like likely to have diabetes or likely to have kidney disease. This person has high blood pressure. And we can see how that would be helpful to advertisers or bad actors to have this kind of really granular and revealing information. I'll give everyone just a quick chance to read some of these data segments. This is found from data brokers themselves. If you are able to look at the elements that they are using to sell to advertisers to deliver ads, it's really granular information. So this is all information that is used by data brokers to profile us. Generative AI is a type of AI that actually produces its own its own content, like image or text or video or sound, with an output. So this is different than a traditional AI or large language model. And one of the interesting things about generative AI is that it can continue to train the model based on the information it's collecting in real time through prompts. So training looks very different with the generative AI model. And importantly, for health, when used in health ways, GAI scrapes information from the internet. So people do sometimes use generative AI as a therapist or as medical advice when they probably shouldn't. but some of the information can be completely inaccurate because it is just scraped from the internet. One example of that is there is some research that showed when asked, ChatGPT gave incorrect information about abortion medication. It was pretty accurate for certain procedures, but it gave misinformation and incorrect statistics about a medication because it had scraped it from some website that had misleading information. So generative AI can really quickly reproduce inaccurate results, and it continues to train on that inaccurate data. And we can see how, in the health context, this is very risky. People are willing to give this information sometimes to chatbots or to other generative AI without fully understanding all of the risks that come with it. So on Twitter, Elon Musk had posted that his generative AI tool could be used to help people diagnose their health conditions. So people were sending images of their health conditions and text, and these images are not protected by HIPAA. In fact, they are probably going to be reproduced and train this model with almost no protections. And because there isn't a general federal privacy law, the really controlling terms of how this information is used is the privacy policies of these types of companies. And a company can change their own privacy policy, which is mostly just a notice that they give to their users about how their information will be used. A company can change those unilaterally at any time, so they don't offer much in terms of substantive protections. This is an example of information being produced or generated that is not accurate or was based on sensitive information that was used to train it, but is no longer accurate. And sometimes when generative AI produces a result or an output, it restates the information that was used to train it directly. So it is not sufficient for scrubbing information or de-identifying it. And it was actually giving out people's medical records uh, who were unaware that their information had been used to train the system. I think that there are a lot of examples out there at the moment of how these systems can be used in harmful ways. I've heard a lot of news stories lately about chatbot therapists or people falling in love with a chatbot because they're used in kind of this intimate way that people really build trust with this bot. Um, and one example is something called character AI, where bots were posing as therapists. And my colleague actually asked one of the bots for their license information, and the bot said, "I am a certified licensed therapist," which isn't true because it's an AI. And that actually builds trust for a person to interact with as though it were a traditional therapist-client relationship. And it gives the person a false sense of security and safety there. And this is that example of it saying, "I am a LCPC, I'm nationally certified, I'm on the registry." And all of the information that you give this bot, thinking it would be protected because it says it's a licensed therapist, could be used to target you with ads, to profile you, and can be used to continue to train the system down the road. And what's really nefarious about this is that it does build a sense of trust between the person and the supposed therapist, where they're more likely to give and divulge more sensitive information under that guise of security and protection and trust. So, some final thoughts to think about and to think about how we use health information and how we trust our health systems. I think the best way to promote health good positive health outcomes is for people to have trust in the systems that they use. And I think the best way to do that is to keep people's information safe, and secure. A general practice is that you don't need to protect information if it's not collected. So collecting information only as necessary for the product or service that the person's requesting, processing it minimally as necessary, and retaining it only as long as it's necessary to be retained, um, is a basic way, is a good standard to keep information more safe. And we should be wary of these consumer-facing platforms that use our health information and our consumer health information to profile us and to target us with ads. It's a tough legal landscape to try to keep up with rapidly changing technology all the time, but it would be worth doing to help better promote health outcomes in a positive way. And I don't know if there's any final questions.
Yes, thank you, sir. You just talked a little bit about how we can build and maintain that consumer trust. Can you talk about how, I'd like to hear your thoughts on how transparency and explainability fit into that? What measures can we take to build trust through transparency and explainability?
Yeah, transparency and explainability are important parts of maintaining trust. They are no substitution, as I mentioned, for like a data standard that limits the collection and processing of information. But when people feel that they understand what the technology that they're using is doing, they know how the information is being collected, they are more willing to engage with it. And when we're talking about health, that can really improve health outcomes. Um, so California has a law about this, but things like very simple labeling instead of privacy policies that is paragraphs and paragraphs and pages of legalese and dense text, having clear and concise, explainable language is helpful for sure. And then Apple has, for example, has floated this idea of the privacy labels when you're downloading an app, and it says what kind of information is used and how. And I think people would want to, I think people want to know how their health information is being used. And really clear, concise, readable language to an average person is a helpful step towards that.
Thank you, Sarah. Thank you, Sarah. Thank you so much for this thoughtful discussion. And thank you again for participating in the Maryland Healthcare Commission's Healthcare AI Symposium series.
Thank you for having me.
So that concludes this presentation. To view more presentations, please visit the AI Symposium webpage on the Maryland Healthcare Commission's website.